and welcome everyone to the session called Amplifying Rotary's Role in Polio Eradication, Strategies for Public Awareness. But before diving into the call, we want to go through some logistics here. As a reminder, please make sure you have accessed this call via the Zoom app on either your computer or mobile device, or be logged into your account if you are accessing Zoom through your web browser. To access interpretation in your language, click the globe in your meeting controls, located at the bottom of your desktop or app screen. You will be able to select your language. Everyone needs to choose their preferred language, even if your preferred language is English. Additionally, please adjust your name in the Zoom to include your current role so we all know each other. I will give everyone a few moments to do this before we move on with our call today. Also, please note that once you select your preferred language, as it showed on the screen, for interpretation, you will still hear the speaker faintly on the background. You have an option to mute the audio of the speaker and hear only their interpretation. So you have to click Mute Original Audio at the bottom of the language selection list. If you're having trouble at any point, please use the chat pane to let us know, and staff will work with you to troubleshoot any issues that come up. Also, please save your questions for the end of the session. We will have a Q&A time for that. Also, during that time, please use the function raise the hand, and we will call on you. If your language, if you have any questions that you want to put in the chat pane, you can do that as well. And if you don't have enough time to respond to all the questions, we will definitely reach out to you later and provide information on the questions submitted in the chat pane. I guess that's it. We're ready to start our call, and I'm happy to invite Sarah Tatzloff, our main speaker for today's call. Welcome, Sarah. The floor is yours.
Thank you, Nina. Thank you, everyone, for joining us this afternoon, evening, whatever time it is for you today. So I am Sarah Tetzloff. I'm the team lead for Polio Plus Communications with Rotary International. And then we also have our support staff here. We have Claire Monroe, who is the Polio Plus Senior Fundraising Specialist. And then Nina, who you've already heard from today, who is the RPIC Senior Officer. And then we also have a special guest, our panelist, EPNC Kim Walden. And thank you as well to our interpreters who are here today. So understanding the initiative. Since 1985, polio has been Rotary's top humanitarian priority. As the organization that first envisioned a polio-free world, Rotary has been at the center of the fight to eradicate polio for 3 decades. We're the organization with the audacity to take on a global effort to protect children everywhere from disability or even death due to polio. And we are the organization with the tenacity to finish the job and keep our promise to children everywhere. Rotary members everywhere should be proud of the work that we've done. Rotary remains fully committed to the pursuit of a polio-free world. Rotarians have contributed more than $2.6 billion and countless volunteer hours to fight to end polio. Together with our partners, we immunize up to 400 million children every year. Because of the efforts of Rotary and our partners, more than 20 million people who would otherwise have been paralyzed are walking today, and more than 1.5 million people are alive who would have otherwise died. When Rotary launched its Polio Plus program in 1985, 1,000 children were being paralyzed by polio every single day in 125 polio endemic countries. We've come a long way. On August 25th of 2020, the WHO African region was officially certified free of wild polio virus. That came 4 years after Nigeria, the last polio endemic country in Africa, when it recorded its final case of wild polio. Next year will be the 10-year anniversary of India's polio-free certification, and today just 2 countries are wild polio endemic, Afghanistan and Pakistan. Polio cases have fallen over 99% worldwide since 1988, and the final stretch of eradication has been challenging. The COVID-19 pandemic disrupted efforts to combat vaccine-preventable diseases, including the global campaign to eradicate polio. In June of 2021, Rotary and its GPEI partners launched a new 5-year polio eradication strategy. That approach outlines new tools and tactics to reach more children with polio vaccines, while also strengthening health systems in underserved communities. The new strategy has 2 main objectives. The first is to interrupt transmission of all poliovirus, wild poliovirus, and the variant poliovirus in Afghanistan and Pakistan, and to interrupt transmission of the variant poliovirus in outbreak countries. And this strategy centers around several key areas, including political advocacy to create greater urgency and accountability in the endemic and outbreak countries, improved engagement with high-risk communities, improved operations and polio surveillance, and including polio immunization in a broader health program sense. As part of the new strategy, Rotary and its partners are using a new tool, the novel oral polio vaccine, or NOPV2, to help address outbreaks of the variant poliovirus. It has been deployed in a growing list of countries and is a promising development in our quest to end polio once and for all. The NOPV2 vaccine is more genetically stable and less likely to regain strength and cause variant poliovirus. And the new vaccine is our best tool for achieving eradication of wild poliovirus. It's safe and effective in eliminating over 99% of polio cases worldwide. As I mentioned, there are 2 endemic countries that remain, Afghanistan and Pakistan. In recent years, Pakistan experienced a spike in cases of wild polio, but in 2021, there was just 1 case in Pakistan, down from 84 cases in 2020. Last year, we saw 30 cases of wild polio virus. However, this year, to date, there have only been 2 cases reported. At this same time last year, there were 13, so we're making great strides. The country has seen a dramatic reduction, and polio surveillance data confirms this progress, and significantly less virus is being detected in the environment. Some of the challenges we see in Pakistan include poor campaign quality, insecurity and mobile populations, politicization of the polio program, and in some cases, vaccine refusals. The government of Pakistan has responded to the serious challenges facing the polio program and has reassessed its strategies to stop polio. Pakistan is implementing an emergency plan and deploying new tactics to strengthen essential immunization, to better target high-risk areas, and to integrate better health services to complement polio immunization activities. To address vaccine refusals, tactics include tailoring strategies and deploying appropriate community influencers based on a family's specific reason for refusal. Rotary continues to hold workshops for religious leaders throughout Pakistan to help communicate to vaccine-hesitant communities around safety and the importance of vaccination. And in April of 2022, the new prime minister in Pakistan convened a meeting of the district commissioners of the highest risk districts in response to the detection of wild polio virus after over a year of 0 cases. Rotary was represented by trustee and National Polio Plus Committee Chair Aziz Maman. And then if in Afghanistan, just 4 cases of wild polio were reported in 2021, compared with 56 in 2020. Last year, just 2 cases were reported, and to date this year, 5 cases have been reported. The country has overall seen a dramatic reduction in wild polio cases. Polio surveillance data confirms this progress, with significantly less virus being detected in the environment. In Afghanistan, insecurity and access issues continue to leave children vulnerable to the virus. However, the polio program in Afghanistan has operated for many years during insecurity and escalating conflict and will continually adapt to the nature of the situation. The current situation presents new challenges, but Rotary and our partners' commitment to end polio is unwavering. We continue to work with stakeholders to finish the job and end polio in Afghanistan. For example, for the first time in over 3 years, the polio program has access to all children in the country, although some continue to reside in difficult areas. Despite these difficulties, the GPEI has maintained polio surveillance across the country over the years and continues to do so. Polio has the potential to be the second disease eradicated after smallpox. So we've had some progress in the past couple of years. Poliovirus is circulating in limited geographic areas around the world. 7 subnational areas now account for 90% of all new wild and variant poliovirus cases worldwide. The circulating vaccine-derived poliovirus type 2 cases, or the variant poliovirus, remained largely the same over the past couple of years, but the wild poliovirus is decreasing. These subnational areas are called consequential geographies. They are affected by complex humanitarian emergencies. They're prone to repeated polio outbreaks that can be difficult to control, and they often export the polio virus to neighboring countries. They're also home to some of the largest population of zero-dose children. That's children who are either or under vaccinated. The consequential geographies include Eastern Afghanistan, Southern Khyber Pakhtunkhwa, Pakistan, the TD province, and its hinterland in northern Mozambique, Eastern Democratic Republic of Congo, northern Yemen, northwest Nigeria, and south central Somalia. The Global Polio Eradication Initiative, or GPEI, is developing tailored strategies to implement in these 7 consequential geographies. That includes offering additional services to meet community needs, conducting multi-antigen campaigns with polio and other vaccines such as measles, increasing environmental surveillance sites to quickly detect the virus, and working to increase routine immunization coverage. Progress in the endemic countries is demonstrated by a couple of things. Only 2 of 34 provinces in Afghanistan reported cases of wild poliovirus last year. Only 7 of 171 districts in Pakistan are considered endemic for wild poliovirus transmission. So these historically low numbers of biologically distinct virus lineages remain in circulation, demonstrating the effectiveness of these strategies. So there are fewer strains of the poliovirus occurring. 2023 is a critical year for polio eradication efforts as the GPEI is aggressively working to achieve 2 significant milestones: interrupt the transmission of wild poliovirus type 1, and report the last case of the variant poliovirus in outbreak countries. We know what it takes to eradicate polio. We have the strategies for effective vaccination and surveillance tools. From a biological and a technical point of view, the feasibility of achieving eradication is wholly established. So we can make history by ending polio, and it'll only be the second human disease to ever be eradicated. But the window of opportunity to achieve this will not remain open forever. So it's important that we finish the job now. This year, Rotary members must aggressively pursue the achievement of these goals by leveraging our strengths, elevating our fundraising, advocacy, and awareness raising efforts as one of the core partners of the GPEI. So we must donate. Donations are matched up to 2-to-1 by the Bill and Melinda Gates Foundation, up to 50 million. We have our Polio Plus societies in your club and district that you can designate funds for yearly to help deliver on our promise of a polio-free world. We can advocate by contacting government leaders and encouraging them to prioritize financial and political support for a polio eradication. We can raise awareness by contacting media to alert them to the role of Rotary and our polio eradication efforts. You can participate in World Polio Day on 24 October and engage other Rotary members. So ensure every club member is aware of the opportunity to be part of history and take action in eradicating polio. So how do we do this? We have quite a few audiences that we speak to, and they sort of cover these 5 different categories. And effective storytelling really starts with identifying the correct audience. You can define them beyond demographics, including how familiar are they with the topics such as polio, their cultural background, their language. Get curious and figure out what are their barriers to donating or to helping to spread awareness. We did some recent research in the Rotary marketing team, which shows us markets such as India, Nigeria, Philippines, and Brazil all have high levels of awareness of Rotary and understanding of the work that Rotary does. Other markets such as Australia, the US, and Western Europe can benefit from initiatives that focus on increasing understanding. We know that word of mouth is the main way that those aware of Rotary have heard about the organization, and online resources, local presence, and social media have contributed to that. In terms of people who are aware of Rotary, 35% are familiar with the End Polio Now campaign, and 3 in 10 are somewhat likely to get involved through volunteering and donating. So if we look at each of these audience groups a little bit deeper, first we have the community activist, whose statement is, Rotary has empowered me to make a real difference in my community at a level I couldn't do on my own. I like to see the results of my efforts and look for hands-on volunteer opportunities. Globally, survey participants tended to identify with the community activist persona the most. And of the countries that we surveyed, the top ones that identified with this were Brazil, France, US, and then UK, Australia, and Mexico, all tied in 4th. Next, we have our supporter, who says that Rotary provides me with valuable social connections and the opportunity to support causes in a way that fits into my busy schedule. I honor my commitments to my colleagues, friends, and family. Survey respondents in Korea tend to identify most with the supporter, and then France and Poland as well. Next is the hand raiser. They say that through Rotary, they're able to connect with like-minded professionals, achieve their service goals, and be recognized as a leader in their community. It's important that the world understands the impact that Rotary makes. Survey respondents in Taiwan identified most with the hand raiser, followed by Nigeria and Korea. Next is our traditionalist. They say that they are proud to be a longstanding member of Rotary. It's important to me that we maintain Rotary's traditions because they contribute to the success and legacy of the organization. The countries that identified most with that were Italy, Taiwan, India, and the Philippines. And then we have the global citizen. And their statement is, Rotary gives me the opportunity to make a difference both locally and globally. I value the opportunity to make friends with people with diverse backgrounds while doing good around the world. And the countries that identified most with that were Nigeria, India, the Philippines, Brazil, and Mexico. So when we're trying to reach this audience, it's really important that we craft compelling messages that are relevant to that audience. So there are a few elements of a compelling message. The first is that it needs to be purposeful. You need to have a clear goal, define what you want the audience to take away or do with your message. Your message needs to be clear and delivered in a way that your audience understands it without jargon or slang. It should be concise. Say what you want to say as succinctly as possible. It also needs to be relevant. So it needs to mean something to your audience. It needs to be credible, true, and believable. And then it needs to be differentiated. It needs to stand out. So you can use personal anecdotes and experiences to help connect with your audience and create a more engaging and memorable story. And then lastly, compelling messages are usually tested and refined. So keep what works and resonates and get rid of what doesn't. There are many communications channels to choose from. Each has its pros and cons. And promoting public awareness effectively requires to choose the right channel. Choosing the right one can make a big difference in how your message is received, understood, and acted upon. The wrong communications channel can lead to confusion, misunderstanding, misinterpretation, or even conflict. And the right communication channel can enhance clarity, comprehension, engagement, and trust. It can also save you time, money, and energy by avoiding unnecessary repetition, clarification, or follow-up. So there are 3 types of communication: verbal, written, and visual. Verbal includes face-to-face communication, phone calls, video calls, webinars, podcasts. Written communication includes emails, instant messages, text messages, reports, social media, and visual communication includes charts, graphs, diagrams, infographics, slides, videos. Communication channels find a way to blend these communication types to convey your message as best as possible. So here's a breakdown of some various communication channel options, their pros, their cons, and some guidance on how to choose them. So first is traditional media, which includes newspapers, magazines, radio, television, and outdoor advertising. And I know someone had asked a question about what's going to perform better, more traditional forms of advertising and or social, and they can both perform really well depending on your message. The pros of traditional media are that you can reach a broad and diverse audience, particularly through things like television and radio. They have credibility because they're established media outlets. And you can do local targeting with newspapers and local radio to target specific geographic areas. However, because they're more of a one-to-many communication, traditional media usually has limited audience engagement and little opportunity to provide clarity. It can cost more money because primetime and television or prominent positions tend to be more expensive. And it can be difficult to measure. It's tough to gauge the impact of a print piece because you can't definitively tell how many people have seen it, read it, engaged with it, or even shared it with someone that they know. Social media is our next communications channel. That includes our social media platforms like Facebook, Instagram, Threads, LinkedIn. They offer interactive and dynamic ways to engage with your audience. So pros of social media, you have a targeted reach. So it allows you to define and target specific demographics, interests. There's more engagement through social media. Users can interact, they can share, they can comment on your content, and they're usually more cost effective. Creating and sharing content on social media is generally pretty affordable. On the downside, there is an algorithm dependency through social media. So visibility depends on platform algorithms, which can change and impact reach. Social media users have a short attention span, so we really need to make sure we capture their interest quickly. And you expose yourself to more negative feedback. Negative comments or backlash can spread quickly if they're not managed properly. Websites are another communications channel. They act as central hubs for information that offer in-depth resources and content. The endpolio.org website is a good example of this. We're continuously trying to evolve and update this to have more and better information for people. This allows you to have complete control over your content, branding, and user experience. You can provide as detailed of information as you like, and a well-designed website offers a lot of credibility. However, the downside is that traffic generation is something that you have to do on your own. You have to drive people to the website, and then maintenance. It requires regular updates to keep it current. Next, we have email newsletters, digital and direct communications. They allow you to reach to a subscribed audience, which is one of the pros. They have opted in to receive this content, so they're more likely to consume it. Emails and digital communications can also be personalized based on subscriber preferences. You can reach them directly, so there's no algorithm issues. They usually convert higher than other forms of communication, and they're really fast. You can get a message out very quick. The cons, however, is that subscription management, you have to build and maintain a subscriber list, which takes effort. Sometimes people say email is overused, and that can lead to people unsubscribing or marking your content as spam. Design challenges, it feels like screens are changing all the time, and so ensuring emails display properly can be challenging, and they can be easy to overlook. You can't guarantee that someone is going to see a message and respond in a timely manner. And then the last one that I have are events. So that can include seminars, workshops, conferences, community gatherings. The great thing about events is their direct interaction. So you can do face-to-face engagement with attendees like we're doing here. It allows opportunities to facilitate networking and relationship building. And you can tailor and customize your messaging based on the audience. However, events can be difficult to plan. They require a lot of time, resources, and coordination. Especially if you're doing a hybrid event or a virtual event, it requires successful technology, which can sometimes be a challenge, especially if there's a hurricane, for example, which Kim is dealing with in her area right now. And then limited reach. Events can have limited reach depending on whether they're in person or virtual or hybrid. So some guidance for channel selection: make sure you understand your audience, determine where they spend their amount of time, what channels they prefer, set the goals for your messaging. What do you want people to do with it? Do you want to reach more people? Do you want them to be more engaged? Or do you just want to educate them? Leverage a mix of channels, so don't just rely on one. So the person that had asked about like traditional media versus social media, there's a way to use both so that you can maximize effectiveness. And then measurement and adaptation. So make sure you're setting up metrics whenever possible to track the effectiveness of your communications, and make sure that you're customizing your messaging as well. So it should be a strategic decision based on your objectives and your target audience's preferences and behaviors, but a well-balanced approach that uses a mix of channels can help you create a comprehensive awareness campaign. So some additional information on leveraging digital communications tools. Social media has really revolutionized the way that businesses, organizations, and individuals communicate and connect with their target audiences. Its power lies in its ability to reach and engage a vast and diverse audience on a global scale. So some aspects of that, as I mentioned before, are the global reach. There are billions of users around the globe. It allows you to be really targeted in your communications and in who you reach. You can tailor content to specific demographics, interests, behaviors, locations. Social media enables real-time interaction and engagement, so you can build more meaningful relationships. There's also the opportunity for content virality to quickly go viral and spread on social media to get more and more attention. And then there's also an opportunity for user-generated content as well. And that's something that we're working on too, is how can we garner and share more stories from Rotary members who are doing really great things in the field of polio eradication, whether it's awareness building campaigns, fundraising, polio survivor stories, and sharing those out because we know that they tend to perform really well. I am going to go to the next slide here. So collaborating with actually, before I do that, Kim, do you want to chime in maybe on these channels and tools? And is there anything that you would maybe suggest or add on to what I've mentioned?
I think you hit it on the head with a couple of things. I mean, it's definitely a matter of timing. It's definitely a matter of making sure that you're speaking to them in the language that they understand as far as platform goes. One club I was in, they were all about the emails and they were all about the handouts. And then another club that I'm in now, they really like to have a newsletter and they're more social media. So if you're not feeding them the content in the right platform, then they're not hearing you. So it definitely makes a big difference about that.
Thank you. Yes, go ahead. John, you have your hand raised.
네, 지금 세라 커뮤니케이션, 소아마비 커뮤니케이션 담당자께서 약 30분간 이렇게 긴 설명을 하셨는데, 상당히 말씀하시는 게 빠른 것 같아요. 그래서 이제 나라마다 이게 이제 통역으로 하다 보니까, 저희들 같은 경우에는 이해하는 부분에 있어서 조금, 좀 어려움이 좀 있습니다. 그래서 우리가 앞으로 이렇게 줌 미팅을 할 때는 핵심적인 것만 이렇게 이야기를 했으면 좋겠어요. 이번 시간에는 폴리오, 그러니까 소아마비에 관련된 이야기를 하기 때문에 거기에 이제 여러 가지로 집중을 해서 말씀을 해주시면 좋겠다. 예를 들어서 미디어라든가 소셜 미디어라든가 여러 가지 이런 거를 전체적으로 말씀을 하시다 보니까 무엇을 얘기하는지 이해가 잘 안 되고요. 우리가 이 코디네이터들은 이 폴리오에 대해서 기본적인 상식은 다 가지고 있다. 그래서 앞으로 이 줌 미팅도 퍼실리테이션 방식으로 이렇게 했으면 좋지 않을까. 지금 1시간 하는데 30분을 지금 세라께서 혼자 다 쓰셨거든요. 근데 그렇게 말씀하신 내용은 이미 저희들이 다 알고 있는 내용이거든요. 그래서 우리가 앞으로 이 폴리오에 대해서 어떻게 대처를 하고 또 어떻게 홍보를 할 것인가 이런 거를 이 귀중한 시간에 서로 논의하는 그런 시간이 좀 됐으면 저는 좋겠다 하는 아쉬움을 좀 가지고 있습니다. 자, 우리나라 이 한국은 이미 1985년도 이전에 소아마비가 완전히 박멸이 돼 있기 때문에 지금 약 한 30년이 넘게 우리 한국은 소아마비가 완전히 박멸이 돼 있어서 우리나라에서 이 소아마비에 대해서 캠페인을 하면 저 사람들 뭐 하는 것이지? 왜 소아마비 캠페인을 하고 있지? 뭐 이렇게 이해를 잘못하는 경향이 있습니다. 그래서 이 소아마비 캠페인은 나라마다 맞게 거기에 맞는 그런 캠페인을 우리가 개발해야 되지 않나. 저는 이렇게 생각을 해봅니다. 그래서 세라께서 말씀하신 그런 내용은 상당히 중요한데, 나라마다의 이런 차이가 있다. 그래서 저희 한국에서는 캠페인, 소아마비 박멸, 이 대치 운동에 관련한 이 캠페인 활동을 많이 합니다. 지역에 다니는 캠페인. 뭐 가두 캠페인이라든가 뭐 이런 쪽으로 대체적으로 많이 이렇게 한다 하는 것을 말씀을 드려보고요. 한 가지 마지막으로 우리가 지금 이 줌 미팅을 하는데 이 소아마비는 그래도 그 현장감 있는 동영상이라든지 아니면은 그 어려운 우리 그 로타리언들이 그 접종하는 여러 가지 이런 현장에서의 그런 자료 화면 이런 것들을 오늘 이런 데서 좀 띄워주고 서로 이해가 쉽게 하도록 이렇게 하면 앞으로 더 좋지 않을까 그런 생각을 한번 해봅니다. 수고하셨어요.
Thank you. I really appreciate that. And you're right. We do only have an hour and there's a lot to cover. And sometimes it's difficult to know what level of understanding people have in different areas of expertise. So that's why I wanted to especially give a good update on where we've been with polio and where we are now, because something that we hear is there's misinformation or not enough information being spread down to the club member level. And so if we have an opportunity to spread the correct messaging with the key people that are talking to those club members, that felt really important to me. For these communications channels, please take what makes sense for you and leave what doesn't. But also you make a wonderful point. It does need to be relevant to your area. And that is something, I can't remember Sanku's last name, but we have meetings with Sanku occasionally who has spoken a lot about, Japan, for example, and polio is eradicated there. How do we make it relevant for our communities that this is still a problem? And we struggle with that in the United States too. And we kind of fall back on the messaging that a case of polio anywhere is a threat everywhere. And last year we saw some of that with New York and London and Israel, where polio popped up in places it had not been for decades. And people were scared about that. Now, much like the pandemic, it has, trailed off. It's not as important now because we haven't seen any additional cases. However, we rely also, the Polio Plus team wants to hear from you, from your zones, your regions, your districts, on why don't people think it's relevant? We travel around the world and people from the endemic areas travel, and that's how the virus spreads. So it is important to all of us, but we need to figure out ways, like you said, to tailor and customize that content so it matters to your community too. And we can work through ways to do that. There isn't one way to make polio relevant around the world, unfortunately, except that we made a promise to children to eradicate this disease, and we're not going to stop until it is.
Sarah, there is another question. I see that AMJ David Chan really want to add as well. And then
Hi, Sarah.
We'll continue.
Can you hear me?
That's fine.
Can you
Go
hear me,
ahead.
Sarah?
Yes, I can. Thank you.
Okay, Sarah, I think we've done a great job in terms of how we need to customize toward each individual or different areas and so on. And you gave a quick overview, but I have several questions. As I see it, the polio has several issues. Number one, people are very tired of listening to polio for year after year. So number one is, people are getting tired. And number two, it's a trust issue. Every year we say, there are a couple of cases or 3 cases, and so on. We really don't trust as to whether we are really measuring correctly, whether there are hidden cases or not. We have no idea. Every year we say 2 cases, 3 cases, and people are used to hearing this kind of stories year after year, and they are getting a little bit tired, and they are getting distrustful about the whole message. So I believe it is time for us to renew, recreate the new momentum for polio. Otherwise, it's going out of people's mind. So I think number one, I suggest, Sarah, that RI, Rotary International, come up with a brand new theme or message or something. Just like, let me give you an example. Goodbye, polio. Okay, simple. Goodbye, polio, or something much more stronger than polio plus, or end polio. Goodbye, polio, or something like that, and recreate the new momentum for the last couple of years, so that we can really end this stupid thing, okay, year after year. And the other question, number 2 question I have is that we have a Bill Gates. We're very lucky to have a Bill Gates, but sub question is, how strong is Bill Gates' commitment to continue with the polio? Because I'm sure that he's also sick and tired of this thing. And number 2, are we looking for new Bill Gates to support this project? I think we need a new Bill Gates in every country, okay? Because we've been depending on Bill Gates too long, too much. We need a new super rising stars who's going to sponsor this thing. And my last question is that there are so many diseases besides polio. And I don't know whether it's a great idea to focus on one particular disease, especially it is in the case of virus, which is impossible to kill most of cases. It's like a cockroaches. So like a COVID-19 is another case. We could have gone after COVID-19 because it has a greater disaster right now, but we are going after polio. So that's another thing that why people are less interested in polio, because there are people dying due to COVID-19. But, my question is, if you look at Rotary history, starting from 1905 to 1985, it's been 80 years to address the humanitarian services, focusing on 6 areas of focus or whatever. And after 1885 to up to now, 1985 up to now, for 40 years or 38 years or so, we've been focusing on polio. People are looking for what service we're going to focus after polio.
Okay, David, thank you so much.
So these are the questions. That's it.
Okay, thank you. Sarah, feel free to comment, and then we can take the answers till the end of the call, so we can continue. Like,
Yeah, I think
you know the time better. Okay.
Yeah, and honestly, I think if it's a more valuable use of people's time to address questions, we can do that versus covering the last couple of slides. A few things. Thank you, David. A few things about what you said. The infrastructure that we have developed around polio eradication has seen success outside of polio eradication. So the COVID-19 pandemic, for example, we were able to take a lot of what we have done with polio and implement that there, which is part of how we were able to address it so quickly, to your point. So we were able to sort of shift some of those resources and take what we've learned through polio eradication and apply that to something different. And that is the plan, that we will take what we're learning here, what we're doing here, and apply it to the next thing, so that, programs of scale, for example, and the malaria, the programs of scale, malaria-free Zambia last year, the polio infrastructure was part of how that was able to be successful. So it is relevant in terms of beyond eradicating this disease. And so it's important to continue to refine it. And surveillance is a huge part of that. And you mentioned, there are cases here and they go up and down. We know when and where they are, because we're able to sample the wastewater. We're able to take a sample of the virus from the child and test it and find out what genetic strain it is. So the science is getting more and more sophisticated so that we can narrow it down to it's this genetic strain and it's in this 2-block radius that the disease is happening. And I'll also add that what we're seeing now, the sort of up and down a little bit, is exactly what we saw in both India and Africa shortly before we were able to completely eradicate those countries. So we are making progress, even though sometimes it feels like it's going on forever. But we're seeing things that we've seen before, which leads us to be optimistic that we're doing the right things. So I will say that. And then we can take a few questions. Nina, do you want to?
Yeah, absolutely. We can make this pause and get to the questions that were submitted beforehand. And I will read them and direct to those who are going to respond. So first question that we received was about collaboration of ARPICs and EPNCs on the World Polio Day promotion and how they can work together. I will start responding to this question based on suggestion by past ARPIC and current EPNC Andres Suarte, who provided response to this exact question. EPNCs can provide to ARPICs the regular updates and reports that have been sent by CIO to EPNCs. And ARPICs can provide strategies how the different information in the reports can be published for different target audiences and assist in publishing the information that can be incorporated with graphics in order to make it easier for the audiences to digest. And Polio Now activities should also involve the ARPICs so that effective communications can be achieved within and outside the Rotary family. We also have Kim, who is the panelist in this call. She's also current EPNC, and she was assistant ARPIC, so she knows both sides. Kim, do you have any recommendations to add?
I agree with that statement, and I would add to it by saying that the ARPICs are really helping prepare the information. They're making sure that the clubs and the districts are using the branding properly in their communications. They're making sure that they have a team of members that are going to communicate the messages in the right time frame. They're making sure that they've got content calendars so they can drip out the information along the way, and covering the kinds of topics that need to be covered. Whereas the EPNCs are getting, as the statement was made, they're getting all the details. So I believe that they're more of the facilitator of the information, and the ARPICs are more making sure that the information that's going out is correct, that it has a nice blend of information and images, that they're using storytelling techniques, and that they're really helping to make the information attractive. So EPNCs are helping provide a strategy. Have they got anyone who's been giving to Polio Plus? Are those people, are their clubs getting that $1,500 for polio each year? So they're helping to drive the content in the way that it best fits for each club and each district. And I think that's what the EPNCs can do. Maybe they're speakers, maybe they're helping provide PowerPoints. So we have a lot of resources on the Polio Plus Society, which is also a really awesome thing that the EPNCs are very familiar with. So lots of different resources, and I think basically the ARPICs are doing the before work and the EPNCs are doing the current activity work. That's how I see it.
Thank you, Kim, so much. So we will go through the pre-submitted questions, if you don't mind, Sarah, and then we'll go back to resources. And at the end, if we have time, we will accept more questions. Is it work? Does work? Yep, perfect. Okay. So are there resources available to highlight Rotary's efforts and local activities for World Polio Day a week to get focused? Sarah, I think that question would be for you.
Yes, we have a lot planned for World Polio Day this year. And your best resource is going to be the endpolio.org website. We are continuously updating that, the toolkit with social graphics, event flyer, email newsletter banners, things like that is being finalized right now. So that should be up on the website in the next few days. We are currently creating several pieces of content to share as well. We have some social media graphics, some videos. Someone, actually, I think both of you had mentioned like more compelling videos, and that's something that we're working on. We're really trying to up the visual interest in what we're doing so that people want to consume the content that we're creating. But this is going to be your best resource for anything that we are creating. And if there's something missing that you would like to see, you're more than welcome to reach out to me and let us know, what you would like to see or what you think would resonate well in your area. Something we're doing differently this year is the toolkit will live on its own page where you can pick and choose the elements that you want to use. And part of the reason for us doing this is we'll be able to go back and measure what people wanted the most and used the most, versus in past years, we've done the zip file toolkit and we couldn't really tell of the contents of that zip file what were people using. So this will be an opportunity for us to do that. I hope that answers the question.
Oh, yeah, that's perfect. I also want to say to all our participants that within a week after this call, you will receive an email, and in that email, you will find the link for this recording. So you can go back and listen in your free time if you miss something. And also, we will have the list and links for all the resources. So then you can look at them and check them and use whatever work best for you. Sarah, do we have more time for a few questions here?
Yes, we do.
Okay. Okay, Claire, question for you. It's a question about maximizing DDF contribution.
For maximizing DDF contributions, I would look to see if a district has unallocated DDF that they've rolled over for a number of years. If they are fully utilizing their DDF, we should thank the district for using it. But if they are rolling over unused DDF every year, I would encourage you to work with the district governor and the district Rotary Foundation chair to make a DDF allocation to polio. They could use this DDF allocation to match club contributions. So the DG and the DRFC could say, we're going to match 1-to-1, 50 cents on the dollar with DDF for every dollar that clubs give to polio for, say, for October, during World Polio, to support World Polio Day. Or if a district doesn't want to give at the start of the Rotary year, maybe get them to commit 10% of their district designated funds for the start of the Rotary year, and then go back in June and see if they're willing to make an additional allocation once they have finished their grant activity and district grants for the Rotary year.
Thank you, Claire. One more question for Sarah. There are other organizations that are working to provide polio vaccines. Should we promote collaboration with these organizations? Any suggestions?
Yes, we should. And that's actually what my last slide was. So one of the things that we do, for example, as partners of the Global Polio Eradication Initiative, or the GPEI, which also consists of, WHO, CDC, UNICEF, Bill and Melinda Gates Foundation, Gavi, we meet together as a team every 2 weeks or so to talk about what are each of us doing individually and how can we promote what each organization is doing individually, and then how can we work on things together. For example, right now we have a campaign going. I'll drop the link for that in the chat, where people are encouraged to record a video about why polio eradication is important to them. And let's see. So my recommendations are to, if there are organizations you know of that are also working to eradicate polio, reach out to them, build a relationship, discuss your resources and how you can benefit each other, because it has to be symbiotic. There has to be a mutual benefit, and collaborate, have lots of communication around what you can do separately, what you can do together, what resources you might be able to share. That's my recommendation for that.
Thank you, Sarah. Also, there is a question. The use of the simplified logo is having its use amplified. Will it be a tendency for us to use only it in the future? I will respond to this question. So at this point, we cannot say about what will be used in the future. At this current point, both logos, simplified and the regular one, are equal, and you can use either one. There's a question, Sarah, about which medium will give you better coverage in 2023, print media or social media, but I think you touched on that already. If you have some final words about that to respond to this question.
I think, yeah, between Kim and I think we covered it. You really need to just be in touch with your area and the way that people consume media and communication in your area. We've heard some people say that WhatsApp group chats work really well for them and their clubs and Rotary members, text messaging campaigns. So I would say just try to get a pulse on what works well in your area of the world and what people are using most.
Thank you. I don't have any questions anymore. I see that John Byung have one question for you. So it's either we ask that question or we'll finalize and ask live question at the end when we have a minute or two.
좋은 말씀들 많이 해주셔서 감사드리고요. 저는 알픽이기 때문에 한국에서 온 알픽입니다. 알픽 차원에서 말씀을 드리면 우리가 이 소아마비 관련된 내용은 가장 중요한 것은 우리가 RI 본부가 조금 전에 사라께서도 말씀하셨는데 이 동영상 제작을 예를 들면 15초짜리라든지 20초짜리라든지 짤막하면서도 감동적인 스토리를 만드는 이런 CF 텔레비전 광고로 나갈 수 있는 그런 성격의 그런 동영상을 정말 아이디어를 동원해서 잘 만들어가지고 보급하는 것이 홍보의 가장 지름길이다. 왜 그러냐면 지금은 우리가 세계가 쌍방향 디지털 시대이기 때문에 SNS가 발달이 많이 돼 있어서 그런 동영상을 일반인들하고도 서로 공유할 수가 있기 때문에 가장 동영상 제작에 신중을 좀 기했으면 좋겠다. 그리고 우리 국제 로타리 웹사이트에 이제 들어가 보면 브랜드 센터라든지 학습 센터라든지 이렇게 들어가 보면 그 각자의 자기가 경험했던 사례 같은 걸 주로 이야기하는데 그러다 보니까 이 로타리의 어떤 이 표준화, 조금 전에 그 마스터 브랜드 시그니처 어느 분이 얘기하신 것 같은데 그것도 마스터 브랜드 시그니처가 있고 또 간편화된 마스터 브랜드 시그니처가 있고 이렇게 두 가지가 있는데 상표라고 하는 것은 하나여야 됩니다. 그래야 로타리안들이 혼동을 안 하는 것이거든요. 어느 때에는 간소화된 시그니처를 마스터 브랜드를 쓰고 어느 때에는 RI가 상표로 등록된 마스터 브랜드 시그니처를 또 쓰게 되고 이러다 보니까 로타리안들이 이게 혼동이 온다. 혼동이 온다는 것은 홍보가 그만큼 뒤떨어진다. 그래서 우리가 마스터 브랜드 시그니처는 하나야 되는 겁니다. 그러니까 우리 여기 계신 우리 커뮤니케이션 담당자들이 그런 것도 참고를 좀 해주셔야 돼요. 자꾸 로타리안들한테 혼동이 오는 거. 그리고 RI 회장은 매년 회기가 되면 테마가 바뀌어요. 매년 테마가 바뀌니까 로타리안들은 그 1년 동안 그 테마에 치중해서 따라가다 보면 우리가 이런 소아마비에 대한 뭐 캠페인이라든가 이런 것들이 뒤로 처질 수밖에 없어요. RI 회장이 주관하는 테마에 맞춰서 가다 보니까 그런 것도 우리가 앞으로 신중하게 검토를 좀 해볼 필요가 있다. 이상입니다.
You bring up thank you. You bring up a lot of great points, all of which we are certainly having conversations about internally, including the theme and the annual theme that changes every year. So thank you for that. Yes, I think we're on the same page, which is good. It just takes a little time to make the change.
It's 9:01. So technically the time is over. I'm not sure if someone want to stay, and Sarah, if you want to answer to David's Chang, very short question.
Yeah,
David,
I just want to say one thing very quickly in 1 minute. Nina and Sarah, you are doing a great job, and I worked very hard last year for polio. I just want to remind all of us that we got to chase after current governors to dedicate the remainder of their DDFs at the end of their fiscal year to polio. There's so much money left over in each district out of their DDF. I think if we just grasp all the remaining balance of the DDF at the end of fiscal year, each year, I think we can really raise the fundraising for polio. That's it.
Thank you.
Thank you. Sarah, your final words.
Thank you again for attending, participating, the great conversation. I put my email address in the chat. Please use it wisely, but always happy to hear ideas and feedback, especially, from your regions. So you're welcome to do that. Yes, I know someone said that people are tired of hearing about polio, but to David's point, I think we only see about 50% of clubs that donate, and any one individual from a club can donate, and that counts for that club donating. So until we get more than that, we're going to keep talking about it. So we hope that you will too, and thank you for all the work that you do.
Thank you so much, Sarah. Thank you so much, Kim, for participating, and thank you all of you for amazing work that you're doing. Good luck. Bye.
Thank you.
통역해 주셔서 감사합니다.
Thank you.
형님 감사해요. 그리고 장세호 총재님, 주성현 총재님 좋은 하루 되십시오.
예, 말씀 잘 들었습니다.
니나
Yes.
감사했습니다.
Thank you. Yes.
세라
Good to see you.
고생하셨습니다. 수고하셨습니다.
세라님 말씀 잘 들었습니다.
Thank you.
각국에서 오신 이태현 씨님들도 수고하셨습니다.
Thank you. Bye all.